Well, my name is Larry Dixon, and I'm the Director of Counseling at the Mind Body Wellness Center. I'm here today with 3 other professionals from Meadville Medical Center, and we'd like to take the opportunity to talk to you about an exciting new program that we have to help the people in our community who are dealing with chronic pain. We're going to spend a little bit of time talking about the history of chronic pain treatment, talk about some of the components of the new program that we're going to introduce. So each of the disciplines that are here today will have an opportunity to talk to you about some of the things that they'll be doing in this exciting new program. Before I go any further, I want to stress that this is an innovative program. Up until the point of Meadville Medical Center deciding to offer this program, in order to get these services, you would have had to go to Pittsburgh, Cleveland, one of the larger cities. So it's really exciting and innovating that Meadville Medical Center was able to bring this alternative methods of helping you deal with chronic pain to the area. I want to start out by giving you a little bit of information about the history of pain management and chronic pain. So one of the first things that I find most interesting about chronic pain is that at the same time, it is one of the most useful things that we have, as well as one of the most dreadful things that we have. Any of you who have experienced chronic pain know the day-to-day dread, the impact that it has on your life, your energy, your outlook, your relationships, your ability to enjoy life and participate in life, and dealing with the daily anxiety and pain that goes along with chronic pain. I started out by saying that it was useful. What I mean by that is that pain tends to be the ultimate teacher. Pain is what allows us to avoid things that are going to hurt us. Pain allows us to avoid things like fire or heat that's going to burn us, poison, sharp objects, or anything else that could possibly cause us harm. It also alerts our bodies that there's something going on. There's an injury, there's a disease, something physiologically is going on within our system, and the pain is the warning sign that tells us you need to stop and make some changes. There's something significant going on within your physical body, within your system, and you need to address it. So again, I think while it's a very useful tool, those of you and those of us who have experienced it know the agony that goes along with the chronic pain. When we talk about chronic pain, it's a very timely discussion or topic at this point. In the news, we hear a lot about the opioid crisis, and we are hearing about people who are overdosing, people who have been on opioid or painkillers and are addicted to them and are trying to deal with that addiction while at the same time they're dealing with their chronic pain. So, as I said, it's a very timely subject. But the point I want to make about it is that opiates were viewed initially as a short-term fix for pain management. And I'm going to talk a little bit about the history very briefly, but the opiates were able to provide very rapid, very high-quality relief from the chronic pain, no matter where we were feeling it in our body, for a significant amount of time. But they come at a high cost. And because of recognizing what that high cost is of using the opioids and being dependent on the opioids, having some of the addiction to the opioids, we're looking at providing to the community alternative ways, along with the pain management docs and the other professionals you're working with right now, to help reduce your chronic pain without the use of those opioids and the problems that come along with those. So if we go back to the 1600s, a little before I was born, we looked at the European doctors, and what they were doing at that point in time to relieve patients' pain is they were using opium. And again, it was very effective. And at that time, they didn't really deal with the addictions or any other matters. They were relieving the pain and went on from there. About 200 years later, in the 1800s, the treatment that came along at that time was ether and chloroform. Those were beneficial in helping to put a patient to sleep so that they could perform longer surgeries or work on correcting the problems within the body and the system. But they also came with some medical questions. Looking at that point in time, if you look at the literature on pain, what they're saying is if we're putting someone to sleep, if we are masking the pain, are we really helping or hindering the healing process? Are we really helping or hindering the person? Because if the pain isn't there to warn them of what they shouldn't be doing and what they're doing to their body, is it really hindering? So even back in the 1800s, that was a question that we really needed to look at, or they started to look at that point. The thought of most of the physicians at that time was that, it was enabling them to help with some significant injuries or medical conditions in the treatment of them. So it continued for some time. Excuse me. In the 1900s, treatment of chronic pain came in the form of morphine and heroin. At that time, they were looking at what the problem was. They were looking at the problem being relative to an accident, an injury, or significant pain that was going along with a chronic condition such as cancer or something else. What they really looked at was this is a way to relieve the pain, and that was their goal at the time. The other thing that came up in the early 1900s was that the doctors were looking at the problem with measuring chronic pain, measuring pain in general. So as you know, if you have high blood pressure, that can be determined by taking your blood pressure. High cholesterol can be determined by a blood test. We do scopes, we do scans, all kinds of medical tests now that will determine what the condition is and at what level the condition has advanced towards or is in recession from. But with chronic pain or with pain in general, there isn't a test to let us know what that level of pain is. So what some of the practitioners in the 1920s, 1930s, and 1940s started to look at was, is there actual pain? And if the pain isn't relative to an injury, to an accident, or to a medical condition that they could determine, was it all in the patient's head? Was it malingering? Is it a patient that's getting secondary gains from the pain medication, from the treatment, from being sick? And so they looked at whether or not, because you can't measure the pain, you can't determine it by a test, is there a possibility that some of these people were feigning or exaggerating their pain to seek the drugs, to avoid some things that they didn't want to do or to get secondary gains? It was at that time that they started to, people who were in pain and the question was brought up, or people who were in pain and couldn't have access, didn't have access to some of the pain medication. These people started to turn to an alternative treatment. At that time it was called psychotherapy, and it goes back to Freud's time. So that people were beginning to sit down with a professional and talk about how they're feeling and what they're gaining from this and what the treatment is like, and looking at what is the impact of our thought process and our emotions on pain, pain level, and chronic pain. What we have gained from that time and up till now is an understanding that, in essence, some of that pain is really in our heads, not in a negative way. So from my discipline, from a mental health perspective, if a person has chronic pain and they are aware of it every time they move, they try to get up or they try to sit down, they try to do a task of daily living, and there's pain and there's discomfort. And our loved ones talk to us and they say, how's your pain? How's your back feel? How are you doing? Can I help you do that? our thought about wanting to do something and thinking, I won't be able to play with my grandchildren because of my chronic back pain. Those thoughts, and every time that thought is introduced by a loved one asking us how we're feeling, or our thoughts about what we can and can't do, or simply moving, every time those thoughts are brought into our mind, they stimulate anxiety. And the anxiety reinforces and heightens the chronic pain. From that perspective, it makes sense to go back to the psychotherapy and talk about it. But that's where we entered into dealing with the psychotherapy or the talk therapy, dealing with some of the alternative methods of dealing with the chronic pain. And the idea that part of that pain or that level of pain is actually in our head. And again, not in a negative way, but just by the everyday occurrences of feeling the pain, thinking about the pain, talking about the pain. So that became one of the means of dealing with chronic pain. There are several others in addition to the medications, but historically medications were the first choice and started in the early 1600s, 1800s as a method of dealing with the pain. There are some other medications. Some of them are oral medications, some of them are topical therapies. So there are things such as non-steroidal anti-inflammatory drugs, acetaminophen, the opioids, obviously, that we have been talking about. In addition to that, there are some medications that are done through a patch or topically applied. Most of them are prescription, some of them are non-prescription, and anyone who has experienced chronic pain or know someone who has experienced chronic pain is probably familiar with all of these medications and methods for trying to alleviate that chronic pain. Some are effective, some are slightly effective, some are ineffective. And the effectiveness of some of these medications waxes and wanes according to the level of the chronic pain that you have. We talk about the history of pain management. There are other ways of treating the pain, other alternatives. Some of those alternatives have to do with stretching, they have to do with exercise, they have to do with different modes and methods of accomplishing the same task of daily living or leisure activity that we want to accomplish. There are alternative modalities such as acupuncture, a TENS unit, that may be helpful in managing some pains. There are also neurostimulators that can be implanted that can be very useful in the treatment of chronic pain. There are methods of treatment that involve injections near or around the pain site or in the general area of the spinal column. So that's another form or method of treating the chronic pain. I'm going to come back to the idea that currently, over the course of the last 30 years, the primary method, the quick, easy fix that people want, is I can take a pill and the pain goes away. The quick, easy method that people didn't want was the addiction or some of the secondary conditions that come along with using the strong opioid medications. So this program that Meadville Medical Center is developing, and we're launching next month, is one that will provide the participants with information from the perspective of mental health, dietary supports, occupational therapy, and physical therapy. We have a team of excellent professionals in the field that will be working with patients in these sessions. The way we develop the plan and the program is that it will run through the course of 1 month. The program will run for 8 sessions, Tuesday and Thursday afternoon from 12:30 to 3:30, and the program is scheduled to be held on the second floor of the Vernon Place. During the 2.5 hours, the participants will have the opportunity to have a mental health professional seated with them talking with them and introducing some alternative ways to deal with pain management. I'm going to go over a couple of those things. There will be a brief break after that 1 hour, and then the occupational therapists and physical therapists will work with the participants of the group on some methods of, again, trying to alleviate, reduce the chronic pain, the negative impact of the chronic pain on their lives. Enhancing your lives, enhancing the lives of the individuals, your loved ones, your friends, your family, who have been dealing with chronic pain for a long time. We're not saying that we're going to work in isolation. This professional team will work hand in hand with the pain management docs. We'll work hand in hand with your primary care physicians and other professionals that are currently working with you to manage your pain. But what we want to do is to be able to provide you with a number of different modalities to address the chronic pain so that you have every opportunity to experience different methods and find 1, 2, or 3 that work for you. Understand a little bit about why and how they work, and have the chance to work with a professional to make sure that you understand how to do them, how to implement them, and have the support of coming back during the next session to talk about what you tried, how it worked, how it didn't work. So some of the things that we're going to be engaging with you in from the mental health perspective is we're going to use things such as breathing exercises. Now that sounds pretty simple. It sounds like, okay, I'm in chronic pain. There's days I can't move. There's a lot of things I can't do. And the idea of just doing breathing exercises is going to somehow help when the opioids aren't working and the TENS unit isn't working and every other method isn't working. It's one method, it's one technique that may work in a line of items and suggestions and modalities that we're going to help you identify for yourself. So one of them does have to do with breathing exercises. Another one from the mental health perspective is going to be guided imagery and the benefits of being able to take yourself mentally, cognitively to a place of relaxation. It's something that we will teach you how to do and give you the tools to be able to do it yourself, to see if, again, it can be one of the tools that you have in your bag to use to deal with your own chronic pain. Mindfulness techniques is a third option that we will go over with you, teach you the rationale behind it, how it works, do some exercises with you so that you have a chance to experience mindfulness and the possible benefits. There are some other therapeutic modalities that we're going to use. These are all strengths-based, and so they're also based on your interests. Some of you might have interest in music or movement or art, and so there's some therapy modalities that deal with music therapy, that deal with movement therapy or art therapy that we will introduce and help you to learn how to do so that you have those options as well. In addition to that, there are some innovative approaches that we use and some very specific techniques. One of them is a Zen tangle, which involves doodling, but it's a very effective method. And I think it's one that people who have interest in art or drawing, those types of things, will enjoy as well. Excuse me. One of the other modalities is journaling and the benefits of that. So those are some of the perspectives that we're going to take from the mental health viewpoint. When the program starts, it will start with a referral from a physician. When the referral comes in, it'll come to the Mind Body Wellness here at the Center for Community Wellness. And our first step is to contact you and set up an initial appointment for us to sit down with you to do an intake, to really look at what's currently going on with you, what's going on in your life, what are your difficulties, what are your struggles, what are your interests and what are your goals. Because this team of professionals are not going to come in and say, this is the goal we've established for you. We're going to come to you and say, what are your goals and how can we help you meet them? it's strengths-based. It's not based on, this is the method I want you to use, so you're going to use it. If you have a strength that is dealing with music, an interest that is in art, those are the things that we're going to be able to use with a wide variety of techniques that we have. So we're basing it on your strengths, what you're good at, what you enjoy, what you're interested in. Those are the modalities that we will help you develop to deal with your chronic pain. From the initial assessment, we will make a recommendation. It's going to go back to the physician, and we will follow up with a PT-OT evaluation, so that before you start the program, the experts, the physical therapists and the occupational therapists, have a true understanding of your level of functioning, where you are, again, where you want to be, what your strengths are. They'll gather that information from the intake. And we will then, set up and develop the plan specifically for you to go through this process. As I said, this is 8 sessions. It'll be Tuesdays and Thursdays from 12:30 to 3:30. It'll run the course of a month and be at Vernon Place. So what we're asking is the opportunity to spend 8 afternoons with you to help you come up with alternative methods to enhance your life, to improve your quality of life, to help you be able to do some of the things that you haven't been able to do because of the chronic pain. So we're excited about the opportunity. I'm going to ask Melissa Guinea to come up next. She's going to talk to you a little bit about the nutritional piece that's involved in this. And then we'll have an occupational therapist and physical therapist come up and talk about their perspectives as well. So, Melissa?
My name's Melissa Guinea, and I am the registered dietitian on the team for the pain management program. I will be providing a class that will teach basic nutrition considerations for relieving chronic pain and inflammation in the diet. We're going to explore what are the healthy food options for controlling inflammation and chronic pain in the diet, and then also we'll discuss unhealthy foods that can increase inflammation. We'll also discuss herbs and spices that may have medicinal benefits. We'll talk about label reading, cooking techniques, recipes. So those are some of the things that we'll be teaching in the sessions for the nutrition. We'll also want to figure out what is your current diet? What are you currently eating, and how do you develop a plan for making some dietary changes? So we have tools and strategies to help you evaluate your current diet and then determine how do you want to make those changes. Now, when we talk about chronic pain and inflammation, as Larry said, it is your body's way of alerting you that something's wrong. So from a nutritional standpoint, there are definite food items and dietary patterns and strategies that you can use to fight that fire. So those are some of the things that we're going to talk about. Some of the eating patterns that are suggested are vegetarianism, the Mediterranean style of diet. Eating patterns like this have a high intake of whole grains, fruits and vegetables. They include nuts, low-fat dairy, and obviously fish. That's one of the basics parts of the diet. So, we find that instead of including just one food item or maybe 2 food items, it's learning to develop dietary patterns that have the biggest impact at reducing that chronic inflammation. So that's basically what the sessions are going to be about that I'll be providing as part of the team. So one of the strategies that you can think about starting is start by incorporating more fish into your diet 2 to 3 times a week. Replace refined grains with whole grains. Try using brown rice instead of white rice, or try quinoa if you've not tried that grain before. Cut out or cut back on foods that have added sugar, such as sweetened beverages, desserts, and then work on increasing fruits and vegetables into your diet. So those are some of the things that we'll be working on. Thank you.
Thank you, Melissa. We're going to have Kelly Parker come up next. She's Occupational Therapy Assistant at Meadville Medical Center. Kelly?
Again, my name is Kelly Parker. I'm very excited to be part of this pain management program. It's really I take it to heart. I do work with quite a few clients now, working with some of their pain management to get them to be more independent with their activities of daily living. So I'm very, very excited about this program. I think we're going to, as a team approach, I think it's going to be very beneficial to the community in outreaching. I just want to give you a brief synopsis of what occupational therapy is. Occupational therapy is an intervention collaborating with the mind, body, spirit, connecting as one to aid in promoting independence with activities of daily living, leisure pursuits, and again, getting back into the work environment. Some of the strategies that we will be focusing on during our topics are healthy routines and habits, occupational configuration, which is taking like a week and having the client write down what a typical day-to-day life would be for them. Sometimes just spacing out their tasks and taking rest periods, or maybe they're resting too much and not really engaging in any activities, which in turn could escalate their pain as their muscles atrophy and puts more stress and strain on their joints. So looking at the day-to-day timing, maybe in the morning, they might have more joint pain, or their pain of sleeping, so spacing out and taking those higher level activities and maybe doing them in the afternoon or early evening. We'll also be looking at socializing and leisure pursuits. When you have a high pain rate, sometimes it's very hard. You've kind of given up on those leisure pursuits. And depression is a big part of it. So looking how we can get the client back into doing what is purposeful and what's important to them. So I can come up, work hand in hand with the client and kind of talking about what is important to them, and then fabricating and coming up with a treatment plan. Other areas, we're going to talk about problem solving, maybe breaking those problems down into smaller subtasks. These are going to be more realistic to solve. Work simplification and energy conservation. How can we get the job done, but conserving our energy? Adaptive equipment training, sitting versus standing, or alternating sitting and standing. Looking at body mechanics. Are we sitting at the appropriate height? Or maybe raising the workspace up so you're not having to lean over so much, or vice versa. If the workspace is high, maybe using a higher stool. And those are just to name a few. We have all kinds of really great adaptive equipment, pieces that we can introduce, and ergonomics. We are occupational therapy. Our team will come into the work environment, maybe look at your workspace, maybe your computer's too high, or your desk is too low, or your maybe there's a desk here that you're constantly having to turn, so maybe looking at more of a different type of chair that you can turn your whole body. So we can actually come into the workspace as well and take a look at that and make those treatment recommendations. I think some of the key things that Larry talked about, which is, when people mask the pain, it gets them through that temporary period. However, they're going to suffer the next day or two. And then unfortunately, it's a spiraling effect. So the more pain, the less likely you're going to do or pursue. So we really want to try to take each task and just slowly introduce one thing at a time so it does not become too overwhelming. But I do feel that what we have to offer is going to be extremely beneficial, and I'm really, really looking forward to working hand in hand with a physical therapist as we work on strengthening, our muscles, stretching exercises. So in just looking at, again, the body mechanics and setting up a home exercise program could be something simple as, we could do sitting, we could sit in a chair and exercise. I have so many folks say to me, can't exercise, can't walk, so I sit most of the day. I'm like, well, there's a lot of different approaches, a lot of different exercises and stretches that you can do just sitting in a chair. And even if you take a walk for 5 minutes, and maybe add an extra couple of minutes on that each week, you're still making that progress. You're still decreasing the stress and strain on your body. So again, I'm just very, very excited to be part of this team, and I look forward to our first class starting. Thank you.
Thank you, Kelly. So one more discipline to talk about. We have the manager of physical therapy department at Meadville Medical Center, Rick Cribbs, that's going to talk to you next.
Okay, thank you. Again, I'm the manager of the physical therapy department, and I will be part of the new group. There will also be several of the other team members from the therapy department participating, and as the program grows, we'll add to that. So the first thing that we will do in physical therapy is, like occupational, is do a individual evaluation, and the evaluation is going to be a little different from an average physical therapy patient, as far as we will be doing more specific standardized testing based on diagnosis, utilizing quality of life surveys, pain profiles, and these are things that we can reassess throughout the course of the month to see how patients are improving. One thing that I do want to stress is that if patients have had pain for a long time and it's classified as chronic, we won't set an expectation of really decreasing the pain a significant amount, but versus trying to teach patients how to live and move and function within the pain that they're having. There may be some pain decrease, and that's obviously a goal, and hopefully that'll happen, but it may not. So there's going to be 8 modules that will be taught in physical therapy, and we tried to coordinate them with the occupational therapy. So a lot of the same things will be taught, but there'll be weeks and there may be some other alternative things taught. So I'm going to just go over these briefly, each of the modules. And so the first module we'll be talking about is just what is chronic pain, and what role does physical therapy play in that diagnosis. As physical therapists, we treat patients with acute and subacute pain every day. But there are some therapists that don't have a lot of experience with chronic pain struggle when they get patients that have these kind of conditions and have the effects of some of the negative effects that go along with a chronic pain condition. So we'll be giving information about chronic pain, its prevalence. And interestingly, there's not a lot of research that is occurring in chronic pain, although it is increasing. In 2014, there was over $30 billion taxpayer money that was provided to the NIH, National Institute of Health, and only about $1.06 per affected person was really dedicated towards chronic pain. Chronic pain really is as prevalent as heart disease, diabetes, and cancer combined, but the NIH spent 95% less on chronic pain research versus those other conditions. So, currently there's about 3,500 studies taking place regarding chronic pain. So, hopefully over time, treatments, including these types of programs, will improve, and those patients will be have better options. Also, in that first module, we'll talk about what physical therapy in general can do for the patients. If the patient has not been enrolled in a individual therapy program, that may be something that could be recommended after the group sessions. We also will talk about some of the new treatments that are out there, some of the new research that's taking place. And one of the biggest things I think in the first module is, somebody's going to dedicate 6 hours a week for 4 weeks into a program. At least I would want to know whether it's going to work. So I will be giving information about research that has taken place with similar programs and the outcomes. And there's some good research that shows that these types of programs work. So that's basically what will occur in the first module. Second module, second part of the first week, we're going to talk about anatomy. So teaching patients about their bodies, what types of structures can cause pain, and it's an introduction to some of the later modules regarding posture and those types of things. So we'll be discussing some general anatomy type things. Third module will be along with occupational therapy, stretching and flexibility. So as patients move, that's really the key is trying to prevent patients from going from an acute pain state to a chronic pain state. But if they do reach that state, one of the things that happens is they develop a condition called kinesiophobia, which is a fear of moving. So movement causes pains, they move less, and that just progresses over time. And eventually they get to the point that they're not moving at all or very little. And then they're setting themselves up really for injuries just with normal activities. So getting patients, teaching them how to properly stretch and restore their lost flexibility, lost range of motion will be important, especially if they're going to move on to a more structured PT program afterwards. The third module will be, again, in coordination with occupational therapy, and then it will include the fourth module, posture, body mechanics, and lifting techniques. Again, teaching patients how, within their tolerance, and how to lift correctly, how to bend correctly, and without causing further injury. The fifth module will be teaching patients about the different types of pain. Acute pain, and Larry talked about this, acute pain, chronic pain, central pain conditions, and And then also within that, what therapy can do within each of those types of pain, what we have to offer to try to control pain and improve the lives of patients in pain. The sixth module will be cardiovascular training. So that's one aspect of therapeutic exercise. So we have the stretching and flexibility, cardiovascular training. So teaching patients how to monitor their heart rate, exercise within a safe target zone, and teaching that there's multiple modes of exercise. We'll probably utilize the YMCA or our therapy gym to teach them how to properly exercise on equipment and how to progress at a rate that is best for them. The seventh module is muscle strengthening. So again, in coordination with occupational therapy, different types of strengthening exercises, how to properly perform those exercises, the benefits of strengthening and stabilizing different parts of the body. And the last is maintenance programs. So after all this is done, patients can't just end on week 4 and go back to their normal lifestyle. They have to continue with an exercise program and teaching them, educating them on different types of maintenance programs, whether it be home exercise programs or maybe joining the YMCA or local club, aquatic exercises. So there's lots of options, and we'll discuss those with patients. Then they'll have a brief reassessment at the end of the eighth module, and again, if there are patients that were that a PT referral may be indicated, we can speak to the physician at that time and get that ordered. So that's what physical therapy will cover. It'll be a lot of detail. I just went over it briefly, but so we are, like everybody else has said, excited to be part of this program. So looking forward to it starting next month. So thank you.
Thank you, Rick. So you've been able to be introduced to a few of the phenomenal professionals from Meadville Medical Center who have been brought into the development of this program and the implementation of this program. We have 2 licensed psychologists who are working on this. We have 7 licensed mental health therapists. There's a team of physical therapists and physical therapist assistants, occupational therapists, occupational therapy assistants, and registered dietitians who have all been involved in the development of this plan, this program that we're excited to present to you. We're excited to offer to the community. Pain is individual. No 2 people have the same pain. No 2 people's pain develops the same, responds the same to treatment. So what we want to help you do as an individual, working in collaboration with the pain management clinics here or in neighboring counties, work along with your primary care physicians, work along with the professional team that developed this program to individually help you meet your goals, to improve your life, the quality of life that you have, to help you get to the best possible place you can be physically, emotionally, spiritually, cognitively. Our goal is your goal, and we're excited to bring the program to you. Just briefly to review, the program will be offered at Vernon Place on Tuesdays and Thursdays from 12:30 to 3:30. It will meet 8 times a month. The referral process is there needs to be a referral from a physician. That can be your primary care physician. That can be one of the doctors from pain management. We have met with the pain management clinics. We've met with other primary care providers in the area to talk about this program. So many of them are aware of it. They have referral forms. If your physician does not have the information, you can obtain the information or get information yourself by calling 333-5214. That number will get you to 1 Vernon Place, where they will be able to give you information or give your primary care physician, your pain management doctor, the information, the referral forms, so that we can get you started towards this program to give you alternative methods of addressing your acute or chronic pain. A few other things. Check my list, make sure I've covered it all. Most insurances are covered. When you call in, when we get the referral and start the process, we will be able to look at your individual plan and be able to let you know upfront what is covered, how it's covered, and how we can manage to get you into the group so that we can help you address your pain and pain management issues at this point in time. Again, we're excited about the program. It's a phenomenal team that has developed it. It's a phenomenal team that is dedicating their time and energy to implementing this and working with the people in the community. So I encourage you to talk to your primary care physician, to talk to your pain management doc, or they may be talking to you about the program. We plan on running it on a monthly basis, so if you're not ready to start in July, maybe you'll be ready for August. So thank you for taking the time to listen to us, to hear what we've had to say, and we hope to see you at 1 Vernon Place, where we can help you meet your goals to address your pain management issues. Thank you.